All right, it's finally here. We are officially starting our, sex ed unit. So here is how it's going to work. I'm going to record some videos of me just teaching you the information. All you'll probably be able to see is the PowerPoint because I cannot figure out how to get myself and the PowerPoint. So you have to see the PowerPoint. And with the PowerPoint, you're just going to follow along with your notes like how we would normally do in class. There might be some activities that I need you to do, but today is just going to be a video that you need to follow along and fill out your notes. So you have the PowerPoint video that you're watching right now. And then if you look on Schoology, listed underneath it should be the PowerPoint notes, which mine are printed in color, but they'll look something like this. So it's 2 pages. I printed mine front and back, but you'll have the one, and then you will have the second one. If you can print these off, that's great. So you can print on them and then write them. If you do not have access to a printer, then you can just write the notes straight into your notebook, but just look at the note sheet to see what you need to be writing. So today we are starting with the female reproductive system. So I want you to think, if we're talking about the reproductive system, what do you think its function is? So the female reproductive system, its function is probably going to be to, or at least one of them is to reproduce. So I'm not telling the females that their function in life is to reproduce. I am just saying that the function of the reproductive system, one of them is to reproduce. So first part in your notes, it says the main functions of the female reproductive system, and there are 3 things. So right here next to this arrow are 3 main functions of the female reproductive system. At any point throughout this video, if you need to take your notes, you can hit pause and fill in what you need to fill in, and then continue going, because I'll probably move a little bit too quick for you to write and watch. So feel free to pause it at any point. So there are 3 functions of the female reproductive system. It's to produce the female sex hormones, which are estrogen and progesterone. It's to produce eggs. And when I say eggs, it's not like a chicken egg, but an egg is a cell that is in the female's body. She's actually born with all the eggs she will ever have, and she stores those eggs in her ovaries, which I will show you where those are in just a moment. But those eggs can also be called ova or ovum. The third function is to provide a nourishing environment in which a fertilized egg can grow and develop into a baby. So if a woman is pregnant, then her reproductive system is going to be the environment where it will grow and develop into a baby. So you need to write down these 3 main functions. The next thing we are going to do is we are going to fill out our diagram. So if you look, you have 2 pictures. You have the front view and you have the side view of the female reproductive system. The side view is already filled in. What we are looking at is the front view. So I want you to think, when you picture a female, is this something you've ever seen? Probably not, because all of this is on the inside of a female. So all these structures that we're talking about right now, or we're talking about first, are going to be the internal structures. So you're going to fill out these structures. You'll write them in over here on this side. So here's where we're going to start. We have 2 ovaries. Well, most of the time women have 2 ovaries, which is 1 on each side. There are most of the time 2 fallopian tubes. So there are these tube-like structures right here. Most of the time there is 1 uterus, which looks like this upside down pear-shaped structure right here. 1 cervix, which is this sideways letter C down here. And 1 vagina or vaginal canal. So go ahead and label those. There's an orange arrow pointing to the terms that you need to label. And then we need to talk about what each one does. So in your notes, it says structure name, and I filled that out. And then it says the function. Some of them are already filled in for you. Some of them you will have to fill in. So we are going to start with the ovaries. Anything in red needs filled into your notes, but I did fill this first one in for you so you knew what to write. So the ovaries are these 2 structures, 1 on each side right here, that look like the letter O or a circle. And they have 2 jobs. So they're going to produce the female sex hormone, estrogen and progesterone. And once puberty begins in a female, once a month, her ovaries are going to release a ripened or a mature egg, and that's called ovulation. So once a month from the ovary, she will release a mature egg into that fallopian tube. And like I said before, the egg is not as big as like a chicken egg. The egg is actually the largest cell in a female body, but when I say a cell, you gotta think cells are microscopic, so it would still be very, very tiny, even if it is the largest cell in her body. The neck structure, which is connected to the ovaries, are the fallopian tubes. So they're these tube-like structures right here. That is a passageway that will carry those eggs away from the ovaries, and that is where fertilization occurs. So fertilization is where one sperm cell meets with one egg cell. So once a month from her ovary, which looks like the letter O, starts with the letter O, a female will ovulate. So also starts with the letter O. So easy to remember, anything that starts with the letter O, think of the ovary. So ovary looks like the letter O, it starts with the letter O, and once a month the process that happens is called ovulation, starts with the letter O, where she releases a mature egg into the fallopian tube. An easy way to remember the fallopian tube is that 1, it looks like a tube, so the fallopian tube, and 2, that is where fertilization occurs, which is 1 sperm cell plus 1 egg cell, if there's a sperm cell present, and fertilization starts with an F, and fallopian tube starts with an F. So if we're going on the path of this egg cell, once a month she ovulates, the egg will go down the fallopian tube. If there's sperm cells there, it can get fertilized. If there's no sperm cells there, it's going to continue to travel. Where do you think it will go next? So the next structure that egg is going to travel to is the uterus. It's this upside down pear-looking shape right here, and it's a hollow muscular organ. And that is where a fertilized egg will grow and develop. So if there were sperm cells present and that egg got fertilized, that egg will grow and develop into a baby inside of the uterus. So a baby does not grow in a mom's belly or her stomach. It actually grows inside of the uterus. A woman's uterus is about the size of a fist when she's not pregnant, but if she's pregnant and there's a baby growing in there, it is a muscular organ, so it's going to expand and get larger and larger and larger. By the end of her pregnancy, that uterus that was the size of a fist is about the size of a watermelon. Now, after she gives birth and the baby comes out of the uterus, it doesn't stay the size of a watermelon. It's going to shrink back down into about its fist size. The uterus is also where, let's say that a female is not pregnant, so the egg did not get fertilized. That egg still traveled down the fallopian tube into the uterus, and that is where it's going to shed its lining off. So the inside of the uterus will shed its lining off, and she'll have something called her menstrual cycle or her period once a month, or about once a month. So the next structure we need to talk about is the cervix, which is this sideways letter C. It looks like a sideways letter C right here. It has 3 functions. So if a woman is not pregnant, what it's going to do is it's going to allow the menstrual blood out of the uterus. So when a female's on her period, the blood does come from inside of the uterus. It allows the menstrual blood out into the vagina. If she is pregnant, it needs to close to keep that baby in, and it closes with something called a mucus plug. And if she's pregnant, when she's ready to give birth or have her baby, it's going to dilate or widen to allow the baby out. So if you've heard someone who's pregnant say that she's dilated to 10 centimeters, that cervix, so the sideways letter C, needs to dilate to 10 centimeters, which is about this wide, to allow the baby out of the uterus and into the vaginal canal. Now, the cervix won't stay open that wide. It will close as well after the baby, well, not close, but it'll shrink back to its size after the baby is born. So after the cervix, we have the vagina or the vaginal canal. It's a passageway that leads from the uterus to the outside of the body. And that's also how sperm enter a woman's body, is through the vagina. So the vagina on average is about 3 to 6 inches in length if a woman is not sexually aroused. If a woman is sexually aroused, then it is a muscular canal, so the vagina can expand and it can contract. So if she's sexually aroused, if she's having a baby, that vagina can expand in size and it can contract. That is also the only natural, quote unquote, natural way for a woman to conceive a baby is through the sperm cells have to enter through the vagina. So any other way, would not get a woman pregnant. So if sperm cells just land on the skin, they can't absorb into your skin and get a woman pregnant. If a female somehow consumes the sperm cells, so let's say they go into her stomach, it cannot get a woman pregnant. The only way that a woman can get pregnant that way is the sperm cells have to enter through the vagina. So they can't enter through the anus. The only way would be through the vagina. The sperm cells have to swim up past the cervix, up into the uterus, down the fallopian tube where they would meet the egg. If there were an egg present, then fertilization could occur, which would be the one sperm cell plus the one egg cell. So these are the structures that are on the inside of the female reproductive system. So we're going to talk about what happens once a month if that female's egg is not being used to produce a baby. Then she's going to go through something called her menstrual cycle, or she will have her period, and that's an okay term to use as well. So during the menstrual cycle, the ovary is going to release a mature egg. The egg will travel to the uterus. If it's not fertilized, so if there are no sperm cells present, inside of the uterus, the lining is going to shed and it will start the cycle all over again. So on average, her menstrual cycle lasts about 28 days. Some women's cycle is longer, some women's cycle is shorter, some women's cycle skips a month, and all of that is okay too. But if we're talking about on average, it's about 28 days. That does not mean she bleeds for 28 days. That means the whole cycle, so from her body releasing an egg, it going down the fallopian tube into the uterus, the uterine lining shedding, the whole cycle takes about 28 days. There are things that can impact her menstrual cycle, such as her diet, stress, exercise, weight loss, or weight gain. And like I said, it can be irregular at times, especially during puberty when your body's getting used to starting that cycle, and that's okay. So here's the menstrual cycle notes. So if you look, you have the same picture in your diagram, and what you are filling out are the days. So 1 is days 1 through 4, and I filled it out for you so you can see what's kind of happening here. So if we're looking at structure number 1, I'm actually going to skip number 1 and start with number 2. It makes it a little bit easier. So days 5 through 13 of the menstrual cycle, an egg is going to mature in one of the ovaries. So you can see the maturing egg here. And what's happening inside of the uterus is that uterine lining is start to become thick with nutrients and with blood because it thinks, hey, there's an egg coming and this egg might be fertilized. So I might need to grow and develop a baby in here. So it becomes thick with nutrients and things that it needs to help support a growing child. Picture number 3 down here, it says days 14 through 15, the ovary is going to release a mature egg. So what is that called once a month when the ovary releases a mature egg? You know, it has to start with an O because it came from the ovary. And that process is called ovulation. So once a month she will ovulate. So picture number 4, days 16 through 22. Now this egg is going to travel down the fallopian tube to the uterus. I'm not sure if you can see this because it's on camera, but if you look at this white lining inside of the uterus, the white lining is a little bit thinner here, a little bit thinner here, and it's starting to become really thick right here as the egg travels down the fallopian tube. So again, it's starting to become thick with blood and nutrients because it thinks, hey, there's an egg coming, and this egg might be fertilized, so I might need to grow and develop a baby in here. Days 23 through 28, that unfertilized egg has now entered inside of the uterus. It's going to attach itself to the uterine wall. And if she was pregnant, what would happen would be the cervix would close and the baby would grow and develop inside of the uterus. But since she is not pregnant, what's going to happen is, so days 1 through 4, the uterine lining is going to shed itself off. So this part of the uterus that became thick with blood and nutrients, since she's not pregnant, she doesn't need that egg and she doesn't need that thick lining. So what happens is the uterus is going to kind of contract or squeeze in on itself to shed that lining completely off, and it comes out in the form of blood. So when a female has her period once a month, that blood is coming from inside of the uterus, and inside of the uterus, it is literally shedding off the inside lining. So gentlemen, I hope you have some appreciation for females because a gentleman will never have to go through the menstrual cycle. So you'll never have to have a period where the inside of your uterus is literally contracting in and shedding itself off. This is just something that females have to go through. So when females have their menstrual cycle, they can have cramps. And if you're a female watching this, you might say, oh yeah, I have cramps, and some females do and some females don't. But cramps are, like I said, are contractions of the uterus, so that uterus is squeezing in on itself to help shed the lining off. When a woman is giving birth, you might hear that she's having contractions, and contractions are the same thing when it squeezes in on itself to let the baby out or squeeze the baby out. Now, the contractions during your period might not be as severe as if you were giving birth, but just think they can definitely hurt, and they can be extremely painful or uncomfortable. And there are some other things that happen during the menstrual cycle as well, if you want to pause and read through those. So the last thing that I want to show you are the structures that are on the outside of the female reproductive system. So this isn't something that you need to take notes on, but it's definitely something that I want you to stop and read. So the reproductive system essentially is everything on the inside that's used to reproduce. Outside of the body, we have other structures. So when I say the female reproductive system, you probably picture what's on the outside and not what's on the inside. So these are the structures that are on the outside. At the very top of the female, you have something called the mons pubis, and we'll talk about what it does in just a second. Next, we have a set of outer lips and a set of inner lips. So the outer lips are called the labia majora, which are the outer set of lips. And then we have the inner set, which are the labia minora. And then we are going to have something called the clitoris, which is located underneath the clitoral hood. And the clitoris is just full of nerve endings. You are going to have a urinary opening, so she'll have one hole that she urinates out of. There'll be the vaginal opening, that menstrual blood can be allowed out of the body, or that's how sperm will enter the body. And then there is the anus. So on the female, there are 3 openings. There's the urinary opening, the vaginal opening, and the anus. So let's talk about what each one does. So the mons pubis is going to be fatty tissue that's going to cover essentially her pelvic bone, and that is at the top of the vaginal area. So the top area is going to be called the mons pubis. Then the outer lips and the inner lips, which are essentially just going to be 2 folds of skin that are going to protect everything. So the outer lips are the ones on the outside. And just think this whole area, pubic hair can grow. So the function of pubic hair is to keep things out that shouldn't be there, to keep bacteria out that shouldn't be there. Just think of like nose hairs. They prevent things from going up your nose that shouldn't be there. Eyelashes prevent things from going in your eyes that shouldn't be there. So there is a function of pubic hair. The inner lips are going to be located, so they're the smaller set of lips, and these ones don't grow pubic hair, but they're the ones on the inside. And then, oops, sorry, wrong way. And then we have the clitoris, which is a P-shaped organ full of nerve endings. The only function of this is essentially to provide sexual pleasure. Everything else has some sort of function. So the mons pubis is fatty tissue that's going to cover the whole area. The outer lips, excuse me, are going to be protect the vaginal openings. The inner lips are essentially going to do the same thing. And then the clitoris is full of nerve endings for sexual pleasure. And then we have the urinary opening, which a female will urinate out of, which is connected to her bladder. We have the vaginal opening, which will allow the menstrual blood out. And that is how sperm can enter the body for the female to reproduce. And then we have the anus, which she will defecate or she will poop from. So yes, girls poop too. So these are the structures that are on the outside of the female. So what I want you to do is, if you need to, go back through and pause anywhere that you need to fill out your notes. And then what I would like for you to do is send me a picture of both pages of the notes, and I will count that as your notebook check or part of your notebook check grade. If you have any questions, email me and I will get them answered as soon as I can.